Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom, and good afternoon, everyone. We have now administered approximately 173,000 doses of vaccine across the province. More than 69,000 Albertans have now been fully immunized with 2 doses. Over the last 24 hours, we identified 273 new cases of COVID-19 and completed about 6,100 tests. Our positivity rate currently stands at about 4.5%. There are currently 235 schools under alerts or outbreaks, which is about 10% of all the schools in the province. Together, these schools have seen 840 cases since January 11th. We have identified 11 additional cases of the variant since yesterday, and on average, variant cases have accounted for about 3.5% of our new cases in February. There are currently 324 people in hospital, including 53 in the ICU. Sadly, I must announce that 16 new deaths were reported to Alberta Health in the last 24 hours. Of these, many were from December and have now been identified post-mortem as being caused by COVID-19. As a result of this thorough process, we are able to report the most accurate total possible. As always, we must remember that every death and every case is not merely a number, but a fellow Albertan who loved and was loved by many. My thoughts are with anyone grieving a loss for any cause. For the past week, the R value in our province was 1.03. This includes 0.93 in the Edmonton zone, 0.95 in the Calgary zone, and 1.13 for the rest of the province. As you know, any time that our reproductive number is greater than 1, it means our cases are rising. I know that many people have questions about when Alberta will move to Step 2 of easing restrictions. We are below the Step 2 threshold of hospitalizations, but we have seen growing cases in recent days. With that in mind, we will be taking the full 3 weeks to assess the data and assess the best way forward. No decisions on moving to Step 2 will be made prior to March 1st at the earliest. We are being cautious, as it is too early to say if this recent increase is significant or but a temporary pause in the strong downward trend we have seen over the past several months. This extra time will allow us to evaluate our current situation. Today is the 174th time that I have joined you to provide an update on COVID-19, and I want it to be a little different. Over the last 11 months, my updates have focused on providing the latest COVID-19 data and trends, as well as my updates on the work underway to protect public health. Each day I've focused on the challenges we face, and rightly so. It is important that we all understand the dangers we face and the importance of being cautious and vigilant. However, it is also important to highlight when there are reasons for hope. We must celebrate good news when we can, if only as a reminder that the sacrifices of so many are making a difference. That is why today I want to talk about some positive trends that we have together contributed to in our province. To help make this clear, I will use a few charts today. This is not my usual approach, but I think these graphs may help show why I think these trends are worth sharing. First, let's start with long-term care. As you know, residents in long-term care facilities have among the highest risks of severe outcomes from this virus. 2 out of every 3 deaths have been in a long-term care or designated supportive living facility. Over the last few months, we have seen a sharp decline in our long-term care cases. As this graph shows, we have gone from a high of 776 active cases in long-term care on December 27th to 63 active cases on February 20th, a 92% decline in less than 2 months. Similarly, the number of long-term care outbreaks with active cases has dropped from 74 on December 20th to just 5 on February 16th. Every one of us should take pride in this turnaround, as it is the result of not only our immunization campaign, but also of our collective efforts to bring our new case numbers down. The same steep decline is seen in designated supportive living facilities. On Christmas Day, we reached a peak of more than 1,300 active cases in these settings. Over the last 7 weeks, cases in these facilities have declined by 88%. These emphasize for us both that the public health measures have worked and that vaccines can have a tremendous protective effect for those who are most at risk. I want to thank the staff and residents in those continuing care and designated supportive living facilities for all of their work. I also know that over the past many months, we have also seen some concerning outbreaks in our hospitals, as well as a significant rise in the number of Albertans needing hospital care for COVID-19. Together, we have brought those numbers down as well, and both outbreaks in acute care and cases needing hospital admissions have declined, thanks to prevention of transmission in the community. From 27 acute care outbreaks at the start of January, we are now down to just 8. This is due to the hard work of many dedicated healthcare professionals across the province. I want to thank everyone who has worked to keep patients safe, as well as apply the learnings from early outbreaks to acute care settings across the province. I know that parents and many others have also had anxiety about safety in schools. As a parent, I understand these concerns and the desire to protect our children. That is why it is good news that, as you can see on this chart, the number of new and active cases in school-aged Albertans has gone down since classes resumed in person. While there are some day-to-day fluctuations in new cases, the overall trend is downward since students returned to school in person. Looking at active cases, on January 11th, there were more than 2,000 in this age group, and 6 weeks later, there were 747. That's a decline of 63% since schools reopened for in-person learning. And it's because together we have reduced our community transmission, and because students, teachers, school staff, and parents have worked every day to keep their schools safe. Finally, I know that many Albertans have lost a loved one to this virus. What we have accomplished together in bringing new cases down has prevented more families from having to grieve more of these losses. This final graph shows the decline in COVID-19 fatalities that have occurred over the last few weeks. As you can see, we have seen a downward trend in the number of deaths reported, from averaging a high of 167 deaths a week at the end of December to 23 over the last 7 days. This is the power of our actions together. This is the power of each of us every day, limiting our in-person contacts with other people. These trends were not inevitable and are not due to just the passing of time. These trends are the result of our willingness to put our community's needs first and care for each other every day. The progress that we have made is not guaranteed to last unless our actions stay consistent. COVID-19 still poses a threat to our province, and our choices still deeply matter. Our cases are starting to plateau instead of continuing to drop. We are seeing steady numbers of new variant cases. Our vaccination campaign needs several more months to reach the majority of our population. All this means we must be extra cautious. If given the chance, this virus will spread widely and we risk losing the gains that we have made together. The downward trends we're seeing in schools, hospitals, long-term care facilities, and other settings serve as a reminder that we have the power to limit transmission when every one of us limits our in-person interactions and when we all follow not only the details of the restrictions in place, but also the spirit of them. With pressure easing on the health system and more vaccines arriving each day, we are making progress. But we must continue to contain the spread of this virus for a little while longer. We have come far, but we have more work to do. Cases in the province will rise or fall based on the actions that each of us takes in the days and weeks ahead. We can do this. We have done this, in fact, and let us take courage from that fact as we face the next few months. Let's keep working together to keep bending the curve down until vaccines are here for everyone who wants them, and we can celebrate what we have accomplished together. lives saved, hospitals kept from overflowing, our communities protected. We can do this together. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Thank you. Yes, the first question is from Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. If a decision won't be made before March 1st, when is the earliest that step 2 of the reopening plan could happen, and how much warning will you give businesses?
Businesses have asked us for a week's notice to be able to prepare, and so that's something that we will strive to do. The exact decisions, as I said, would be made at the earliest on March 1st, and so we'll see how our numbers are trending over the next several days to the end of this week. And so businesses should be planning for a reopening as early as the following week.
Operator, could you put through the next caller, please?
Thank you. Julia Wong, Global News.
Hi, Dr. Hinshaw. As you noted, the R-value positivity rates, case counts have been rising. The number of variant cases have also gone up quite a bit the last couple of weeks. Can these be attributed to the province moving into step 1 of reopening? Where are these cases coming from? And would you qualify reopening as a success, or do the numbers give you pause?
It's always difficult to pinpoint exactly where every single case comes from. When we look at the data over the past couple of weeks, what we see is that our school-aged cases have mostly continued to drop. Again, a little bit of a plateau in the last couple of days. But where we've seen the biggest increase in our cases has been in older Albertans, those over the age of 30. So I think there are several factors. We have some outbreaks going on right now in different settings. We also know that of those Albertans over the age of 30, then when we look at all of the places where they've acquired disease, there are about a third of them where at this point they were not able to pinpoint exactly where that disease was acquired. So we are still seeing some community transmission trends that unfortunately we're not able to exactly identify the source, and that often happens when people have multiple activities where they may have been in close contact with people over the course of the 2 weeks before their infection. So this is really a call to all of us to make sure that we're thinking about the things that we do every day, limiting our in-person contacts. When we are in person in a space with someone outside our household, staying distanced, wearing a well-fitting mask, those are the things that we can all do every day to bring our numbers down.
Operator, can you put through the next caller, please?
Thank you. Elise Stolte, Edmonton Journal.
Hi, Dr. Hinshaw. When I talk with care homes, it sounds like somewhere around 5% of residents or the family members making decisions for them are declining the vaccine. I'm wondering, are those the numbers that you're seeing? And will the presence of unvaccinated residents prevent families from visiting vaccinated residents? And when will you start to allow more visits in vaccinated homes?
The first question was about the percentage of residents or their surrogate decision makers who are declining vaccine. And we certainly have seen well over 90% of residents who are accepting or their surrogate decision makers. I don't have the specific numbers. You've referenced 5% in those that you've spoken with. And that's something that we can look into and get back to you with a specific number. But what's been reported to me in congregate living facilities where seniors are living together is that the vast majority of residents are choosing to be vaccinated given the significant risk that COVID-19 poses to them. With respect to the impact of vaccines on ability to visit, that's something that we continue to evaluate. We're still monitoring and watching closely as the vaccines roll out around the world to understand the impact that vaccines have on the ability of a vaccinated person to potentially transmit the virus to others. And until we have better information on that, we do still need to maintain our current approach. And we're hoping that once we get additional information on the protective impact of vaccines, not just against symptomatic infection for the person who's vaccinated, but also protecting that person from spreading to others, that we will be able to adjust our visitor policy in an appropriate way, making sure that we continue to protect individuals from those severe outcomes.
Operator, can you put through the next question, please?
Thank you. Jennifer Lee, CBC.
Hi, Dr. Hinshaw. I'm wondering if you can provide a bit more information about the variants and some of the numbers that you're seeing. The province has been tracking variants of concern for several months now. So what can you tell us about the doubling time for the variants, in particular V117? And what is your sense of just how widespread community transmission is right now? Like, how would you characterize sort of your comfort level with what we're seeing in terms of community transmission in that way?
We are seeing several over the past few days, ranging from around 11 new variants, as I reported today, up to 15 or 16 new variants, and we've seen that same new daily number over the past several weeks. So the new daily number of variants is relatively stable. Some of those numbers are retrospective testing still. So again, we're testing samples over the period of several days as we're working to increase the speed with which we move those tests from a COVID positive through to the screening process for variants. And when we're looking at our doubling time, again, it's really important to remember that the variant cases that we identified earlier in the year were mostly travel related. And it's really only since the end of January, the beginning of February, where we have been able to screen every single positive case in the province for variants. We currently see variant cases in 3 of our 5 zones. So Calgary, Central Zone, and Edmonton are the zones where we have seen variant cases identified. We have not seen any cases in South Zone or North Zone to date, but we do know, of course, because people travel back and forth across the province, that we all need to be vigilant no matter where we live. It's also really important to remember with the variants that what we are doing right now is very intensive follow-up. And so what we're seeing is for every case that we identify, we're identifying several additional cases as we do our close contact follow-up. Many times that's spread within households. So some of our numbers are actually as a result of our containment strategy. Right now, again, it seems that our numbers are relatively stable, and it's a bit early to be able to provide an accurate doubling time, again, because we don't want to conflate the early screening numbers of travel-related cases with community-acquired cases. So we need to give a bit more time to really understand what we're seeing with respect to community transmission. But what I would say is that the variant certainly is established at a low level in our community, and we need to work together to prevent it from becoming established at a higher level.
Operator, can you put through the next caller, please?
Thank you. Jesse Weisner, Global TV.
Well, hi, Dr. Hinshaw. Last week you said there were no benchmarks for indicators such as R-value, positivity rate, and case counts, but some of those indicators have grown in the last few weeks. What qualifies as concerning growth or a concerning increase to put the brakes on reopening, and how do you quantify concerning growth?
When we talked about the leading indicators last week, the important points that we need to be watching for are whether or not those leading indicators are stable, are they declining, or are they increasing. And unfortunately, what we've seen over the past several days is that our positivity rate has started to go up, and that our R-value has also started to go up in a concerning way. So we are seeing growth in several of those leading indicators. And in terms of what's concerning or not concerning, we want to see our case counts either being stable or going down, because when cases start to grow, if that's sustained over time, then we can get into a situation like we were in the fall. And that's why we need to take the full 3 weeks to be able to look very closely at where those numbers are coming from. Are there patterns? Are there things that we can do to be able to target particular locations? And give us that chance to fully evaluate whether this is a few-day fluctuation or whether this is a longer trend that is concerning.
Operator, can you put through the next caller, please?
Jason Markusoff, Maclean's.
Thank you for taking my call, Dr. Hinshaw. I'm sure I'm not the only Albertan who does see progress in some of those charts that you presented, but I also see the very, very sharp and steep incline that was, frankly, quite striking to see from the second wave. I wonder if, looking back at those steep spikes you wonder what more you could have, government could have done or others could have done to help limit those spikes. And On the subject of curves, I'm wondering what you take from the Public Health of Canada's latest modeling on the effect of variants and potential action or non-action on COVID.
The important part of looking back to our experience in the fall is making sure that we evaluate that in terms of what we can learn and how that informs our actions going forward. What's clear is that when COVID-19 is growing, it continues to have that growth pressure behind it, which is exactly why we're wanting to not move too quickly into any further actions to open activities before we get a full sense of whether or not, again, we're starting to enter another growth phase. So we are being very cautious. With respect to the modeling on variants, again, it's important to remember that modeling doesn't tell us a future that is inevitable. What it tells us is what could happen if we don't take steps to avoid it. And so it's critical that right now, all of us every day are thinking in our daily lives how we can make sure that we're limiting our in-person interactions, make sure that when we are in person with somebody who's not in our household, that we're staying distanced from them, wearing a well-fitting mask, all of those things that we talk about all the time. When we're doing them in a regular and consistent way, they will help protect not just against the COVID-19 that we've had here for many months, but those regular, persistent, consistent actions will also help us against variant strains. And that modeling is a future that we do not want to see.
Operator, could you put through the next question, please?
Thank you. Our final question is from Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. Thanks for taking my question this afternoon. I just wanted to follow up for a bit of clarity on my colleague's question about what is considered concerning growth. You said you want counts to remain stable or go down. So if we continue on the trend that we are seeing right now, does that indicate that we would be pausing as of March 1st, given what we're seeing right now? And the R value is lower in the Calgary and Edmonton zones. Is there any way to possibly look at a regional approach to reopening, or is that still something not really on the table right now?
It's encouraging, of course, that in Calgary and Edmonton we don't have an R over 1. However, you may recall that for the last few weeks our R values in Edmonton and Calgary have been down around 0.8 or even 0.7. So this is currently, I would call the current R values getting closer to more of a plateau and less of a drop. We know that in order to drop our counts in hospital, we need to drop our new cases because the new cases are a leading indicator. So in order to keep moving forward, we have to make sure that we are overall, over the course of weeks, continuing to push towards a decline in cases in order to push towards that decline in hospitalizations. So with respect to what would constitute a concerning trend, continued growth would be concerning. It is always important to understand when we do see an increase in new cases or an increase in positivity, what all the different factors are that are going into that, which is exactly what we're doing this week, to look at where we're seeing outbreaks, where we're seeing transmission, and whether or not this is a more universal spread or if this is something that's in a few targeted locations. But again, the really important part that Albertans can take away from this is that collectively we need to continue doing all of the things we've been doing to bring those numbers down, as I showed today, so that we are able to continue considering that path forward, and that will only happen if we all work together.
All right, there are no more questions in the queue, so that concludes today's availability. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.